So today here we're working with Michael. He's about 6 weeks post-op out of a rotator cuff repair with a biceps tenodesis. So what we're doing here is we're trying to assess his external rotation range of motion. So based off the protocol for the next 6 to 10 weeks, we want to keep that rotator cuff repair site nice and safe. So we're only going to focus on really ranging that shoulder from 0 to 30 degrees. Every surgeon's a little different, so you gotta be familiar with the individual orthopedic surgeon's protocol to get the optimal recovery for your shoulder. So here in the clinic, we'll typically work on ranging the shoulder for 3 sets of 10 if the shoulder's feeling good, or if there's like a little bit more pain, we'll do something like 5-10 second holds so that the shoulder's healing nice and well and it's not irritating the muscles of the surgery site. So in the clinic, what we look at doing is we look at stabilizing the elbow, and then we look at rotating the forearm out so that we make sure we're getting external rotation of the shoulder. And what we also do here is we keep the elbow up in the same line as your shoulder so that when we go to rotate, the mechanics are optimized, so that if we just let that arm hang down, you don't have the perfect alignment going straight towards that shoulder. We just kind of want to keep that arm nice and level, and you'll get optimal range of motion there. So at home, what you can do is roll up a towel with some tape around it and get that elbow in that same plane of movement. And then we'll grab a stick here, and then we're going to ask the patient to do the same thing. So now we're just going to rotate from the opposite hip, try to get as much range of motion as we can to about that 30-degree mark and hold it there. So like I said, every surgeon's protocol is a little different. What we can see is that he has more than 30 degrees. It doesn't necessarily mean that you want to stretch beyond that. You just want to go to that range of motion mark of 30 degrees, and then maybe once a day or once every couple of days, you just want to take up that available range of motion without stretching it, so that adhesive capsulitis doesn't set in. So, depending on how Mike's feeling, we'll do 3 sets of 10 there, or we would just do like a static hold. Take that away. So the next motion that we're taking a look at is his assisted shoulder flexion range of motion. So we're looking to go from 0 to 100 degrees for that 10-week goal. So with the 10-week goal, we want to be able to comfortably get his arm up to at least like 100 degrees so that he's ready for the next phase of rehab. So what we're doing here is we're supporting his elbow to prevent any excessive load from gravity pulling down on it. And then we're also going to grab from the wrist to provide some type of force to pull up to better stabilize that arm. So then we're just going to go up to 100 degrees, hold it there for 10 seconds or so, and then come back down. So if you don't support the elbow, sometimes the patient doesn't feel like they're getting adequate support. And then same thing with like coming down, you're not allowing that shoulder to rest. So in order to prevent the patient from actively contracting and tightening up that joint, you just want to stabilize that elbow down. And then again, we can kind of do 3 sets of 10, or do that 10-second hold to best optimize that range of motion. And if we take a look at Mike's range of motion, you can see that we can go a lot further. Like again, doesn't necessarily mean that you should be stretching it that far. You just kind of want to stay within the protocol guidelines. So holding it there for 10 seconds, and then coming back down. So if we were to do this exercise at home, we would ask Michael to grab that wrist. Now Mike has issues or some impairments with the opposite side, so we just got to be aware of his rotator cuff impairments when we're ranging that right shoulder. So obviously here we're getting to that 100-degree mark, or about 100 degrees. Hold it there, and then coming back down. So at home we would just do the 3 sets of 10, or we would do the 10-second hold depending on what the goal of treatment is. Again, with Mike, we can get his arm past the 150 degree. We can get his arm past 100-degree mark. We could probably go closer to almost like 140, 150 on him, but we won't go that far. But every once in a while, you just kind of want to take up that available range of motion to kind of keep things loose without stretching it out. And that's the rotator cuff.